The Department of Health, Dr. Stephen Lucas, Deputy Minister, Eric Costin, Associate Deputy Minister, Michelle Boudreau, Associate Assistant Deputy Minister, Strategic Policy Branch, Karen Stewart, Director General, Resource Management and Advisory Services Directorate, and from the Public Health Agency of Canada, Heather Jeffrey, President, and Martin Crumans, Vice President and Chief Financial Officer. There's such a vast number of officials here in support of the Minister that not all are seated at the table, but if any are required to respond to one of the questions that are posed by members of Parliament, they'll simply approach the table. So with that, by way of introduction, we welcome Minister Holland and invite him to make his opening remarks for up to 5 minutes. So welcome, Minister. You have the floor.
Thank you so much, Mr. Chair. It's a pleasure to be back before the committee. In this instance, to address Supplementary Estimate C. I would be remiss if I didn't start by thanking Dr. Stephen Lucas. Many of you will have heard that Dr. Lucas is retiring. And Dr. Lucas's incredible leadership is a massive part of why we had the incredible pandemic response that we had. He leads an extraordinary team of officials, and it has been my extraordinary pleasure over these last 8 months to work alongside with him. He will be sorely missed, but on behalf of all Canadians, I want to thank him profoundly for his contributions to our country and to health. And colleagues, I come at a time where we're seeing fantastic things happen in our healthcare system. Just this week, I started it on Monday with Everett Henley in Saskatchewan, announcing our shared commitment to work together on healthcare with a health agreement that covered both aging with dignity and working together, tackling the challenges and the crisis that we have in primary care by setting aside partisan differences, focusing on what we have in common, and frankly, getting things done for Canadians. That's 10 bilateral agreements that have been already announced across the country. Well, actually, many more, because some of them are aging with dignity and some of them are working together. In totality, they will be 26 agreements. And next week, I'm going to be having an opportunity, you've heard the agreement in principle with Quebec, to be finalizing that. And that's part of our $200 billion commitment to the Canadian healthcare system. To make sure that where we already have one of the best healthcare systems, and we just saw something, in fact, just a couple of weeks ago saying that we're the #2 healthcare system in the world, to have an opportunity to be head and shoulders the best healthcare system in the world. But it's not enough to tackle the crisis of the now, whether or not it's in aging with dignity or in dealing with workforce issues. We're also looking at preventative care and going upstream. Over 1.5 million seniors have signed on for the Canadian Dental Care Plan, and so we're super excited to see such an incredible rate of participation. And I can say that as I go across the country and meet with hygienists and dentists and with denturists, that it's phenomenal to see so many signing up, getting ready to serve people in many instances who've never seen an oral health professional. And of course, how can we have the best healthcare system in the world if 25% of our population doesn't have access to oral health? So we continue to move forward on dental care. I'm also exceptionally pleased, and I see Don Davies on the screen, to have worked very closely with Don. There was a lot of difficult negotiations, and I want to thank all parliamentary colleagues, and Sonia for, particularly on the diabetes side. We were able to announce the first steps towards a national pharmacare plan. And we're starting with universal contraception and diabetes drugs. And I just want to talk for a minute about how significant that is. On universal contraception, this means that no woman anywhere in the country will have to worry about whether or not she has access to the reproductive medicine that she needs to have autonomy over her own body. It means that wherever somebody is, they are in control of their body, their sexuality, and their reproductive future. That's not only important as a matter of direct application, it's essential to broadcast as a message about sexual health in this country, that sexual health is health, that we need to be able to have conversations about sexual health in the same way that we have conversations about any other aspect of health. And I hope that it starts a conversation around sexual shame and what we need to do to ensure that people are able to freely be themselves in this country. On diabetes medication, it's going to mean, and I could give you an example in an Ottawa clinic, going in and speaking to a nurse in a diabetes clinic who says, I'm watching patients reuse syringes, watching patients who can't afford their medicine, which means that they wind up in a situation where they have an amputation. That shouldn't be happening in this country. So I'm so deeply proud that we were able to work in a cross-partisan way to do something that will so significantly impact the lives of so many. And it is in that cross-partisan spirit, I hope that we meet here today to have important deliberations about how we can serve Canadians and their health. Thank you, Mr. Chair.
Thank you, Minister. We're now going to proceed with rounds of questions, starting with the Conservatives. Dr. Ellis for 6 minutes, please.
Well, thank you very much, Chair, and Dr. Lucas, thank you for your service to this country. We all appreciate it, and we wish you well in your retirement as well. Fabulous. Chair, through you, if I could, Minister, who is the minister in charge and responsible, I'll use that term perhaps better, for the Public Health Agency of Canada?
That would be me.
That would be you. Excellent. When was the first red flag raised about the two scientists at the National Microbiology Lab in Winnipeg?
Well, the first time that it would have come to my attention would have been as a parliamentarian, going back to the debates we had in the House. At the time, I would have been whip. Of course, government House leader
just
is...
the date, Minister. I don't need a story.
I wouldn't recall the exact date. It would have been around that period of time when it was, 2018, 2019, that kind of time. I was a parliamentarian. I was a whip at the time.
So what you're telling this committee is that before that time there were no red flags raised about two scientists at the National Microbiology Lab who turned out to probably and most likely be foreign agents.
Well, no, I was saying at the time, that's when it came to my attention, I was the whip. If you'll indulge me, I can turn to Heather Jeffrey, who can tell from a PHAC perspective.
Just a date, please, Ms. Jeffrey.
The first concerns were raised in September, October 2018.
September, October 2018. And was it the discovery of the DSO of a patent registered in China that raised that red flag, or what was the cause of that, Minister?
Well, again, I'll turn it to...
You really have no clue.
Well, no. First of all...
Okay, thank you very much. Ms. Jeffrey, what's the answer to that? Was
Yes,
it the discovery of the patent?
Yes, Mr. Chair, that was the first evidence.
Very good. When we look at that, it's interesting, though, isn't it, that China requested samples to the Wuhan Institute of Virology, and then the day after that, is it not true that Dr. Chu then traveled to China?
Look, I think that at the time,
I didn't ask you about what time it was. I asked you, is it true that the
Well,
Wuhan
it depends on whether or not you want an answer.
Excuse me, Minister, please.
I appreciate that you have a line of questioning that you want to, but if
Chair,
I'm not able
is
to
this
answer...
the type of answer that we're going to get
I'm
from
not
the
able to
Minister
answer
as
his
we did
question in the
before
time
with
that
this
has been
continuous interrupting
I'm not
from
able
him,
to answer the question
knowing
in the
that
time
full
provided.
well it's my time to ask questions and not his? Is that what we're going to have here today, Chair?
Go ahead with your question, Dr.
Thank you very
Ellis.
much.
Please let him finish his question, Minister.
So, is it the day after that the Wuhan Institute of Virology asked for samples that then this agency run by yourself, you clearly admit that, then allowed a scientist to go to that actual Institute of Virology? Is that true or not?
Well, I disagree with your characterization, and if given the opportunity, and clearly I'm not, I would be able to provide context and be able to answer your question. But
well, it's a very simple question.
But I disagree with the way you're characterizing the information, and I don't think it's a fair either reflection of the circumstance.
Okay, how about this then, Minister? Think about this. Red flags were raised. The Wuhan Institute of Virology asked for samples of perhaps two of the most dangerous pathogens in the world, Ebola and Henipavirus. And then a scientist from a lab under your direction then went to China. Is that true or not?
What is true is
Are
that
the facts there or not?
What is true is that at that moment in time, we were collaborating with China on, yes, viruses like Ebola. It was part of an international effort to try to ensure human safety. And two Canadians,
Minister,
the two
then
Canadians
you think
that you're
it's
referring
okay
to,
for a scientist who has red flag raised in their activities to then travel to a place who has requested dangerous pathogens from our lab? You think
I don't
that's
think
okay?
it's okay that the two Canadian
Well, you're
citizens.
justifying it. Is it okay or not?
I'm saying that the two Canadians that you're referring to, who are eminent scientists, who are well published in North America.
Through you, Chair. Minister, they're eminent scientists. Where
I'm sorry,
are they now?
Mr. Chair, I don't understand how this works. Am I
This
given
is
afforded the
ridiculous.
opportunity to speak, or is this?
No, this is absolutely ridiculous. Where are those two scientists now, Minister? Where are they?
So,
Where are
again,
they?
Okay, look, I don't have no idea where the two
You
scientists
have no idea?
are.
Do you
of
not
course,
read
I don't.
the
I don't track
newspaper?
them. I don't suspect that you know. That's the job of the RCMP. I'm not law enforcement, but
Oh, so,
but
okay,
I
very
think
well.
if you would
don't know
afford me the
answer to my
opportunity to
question.
speak,
Are they living under assumed names at the current time?
Look, there's a mirror over there if you want to talk to it. If you're interested in talking to me,
You know
afford
what? I
me the
don't need your
opportunity
smart
to
mouth
speak.
answers. What I need is you to answer the questions that I'm asking you, not your smart aleck answers. Are we going to
so
see the
far,
bombast that we
with
had
all
from
due
you
respect,
last
Mr.
time?
Chair, I have
and your
been- I've
petulant
been afforded
behavior?
no
Is that
more
what
than-
we're going to see?
I've been not able to get a sentence out without interruption.
Well, you refuse to answer the questions, Minister. That's your problem.
that's your interpretation, and you're welcome
no,
to
that's
it.
the truth.
But not allowing me to speak,
So, Minister,
I don't
where
understand.
are those two scientists now? Where are they? Do you know or not? Simple.
Rightfully, it matters as to where they are in an investigation.
No,
It is
do
a
you
matter
know
for
or
law
not?
enforcement,
What's
not
the
for a
answer to the
minister of health.
question?
A minister of health is not responsible for law
Do
enforcement.
you know or do you not?
Why would I know where they are?
So the answer then is no, you have no clue.
Why would I have any clue where they are?
Right, you have no clue. That's very clear. Do you know that they're living under assumed names in China?
Look,
Yes or no? These are simple questions. Do you know or do you not?
I'm not involved with law enforcement.
I didn't ask you if you're involved with law enforcement.
I don't know what you're getting at. I don't have any
I never
involvement
asked you if you
with
knew what I
law
was getting at.
enforcement.
What I asked you is, do you know that these two scientists are living under assumed names in China? Do you know or not?
I have heard media reports that might be the case, but I am not involved in law
So you
enforcement,
really
and it
have
is not
no
up to
idea.
me
Very
to
well.
assert the
then-
veracity
That's your time,
or whether
Dr.
or not
Ellis.
those statement is true.
If it's
I
my
think
time,
it's a
then
fundamental
his time as well.
misunderstanding
If
of
he could
the
turn his
role of a
microphone
minister
off,
of the
that
Crown.
would be excellent.
Yeah, thank you. Next, Ms. Sidhu, please, for 6 minutes.
Thank you, Minister and officials, to being here. And thank you, Dr. Lucas, for your great service. Minister, my first question is about diabetes. As you know, one of the most common chronic diseases affecting Canadians. Approximately millions of people in Canada are living with this disease. And our government has already taken steps forward with the introduction of a national framework for diabetes in Canada. Can you lay out how the new pharmacare legislation continues this work and impacts Canadians living with diabetes?
Thank you very much, MP Sidhu. And I want to start by saying that we wouldn't be here without your advocacy. Your incredible work in the space of diabetes is deeply appreciated. I've been having really exceptional conversations with all provincial and territorial health ministers around how we can work together. Set aside the differences that we have. This is about patients. This is about making sure that patients get the medicine that they need and the devices and apparatus that they need. And so this is universal in nature. It means that it'll be blind to somebody's age, and it will mean in every instance that folks have the medicine that they require. And I think it's important to acknowledge that I think this is going to save an absolutely huge amount of money. I mean, forget about the fact that the illness it's going to save. The instances of other illness. I was with heart and stroke, and how tragic it was to see improperly managed diabetes manifest in cardiovascular events, or for it to manifest in so many other maladies. To prevent that loss of limb, is phenomenally powerful. And so, and on the apparatus side, people shouldn't be forced to make a decision about whether or not they reuse a syringe, or whether or not they're going to be able to monitor their, manage their illness or pay for their groceries. So I want to thank you for your advocacy, and I think this is an extraordinarily important initiative.
Thank you, Minister. My next question is, long-term care homes were hit incredibly hard